Hello, I'm Wally Taylor from Forum Health Austin. Today, the topic I want to discuss a little bit is something that happened recently at the FDA, and that was the banning of an additive called red dye number 3. So red dye number 3, which has been in our food supply here in the United States for many years, was actually found some time ago to be associated with chronic illness, especially even cancers that were shown to be related to exposure to red dye number 3. Now, in my practice, I have seen a lot of increased illness due to exposure to red dye number 3 and many other food additives. In fact, I've seen, unfortunately, in the last couple of years, at least 3 cases of colon cancer in individuals under the age of 40, which I have to say, in my history of doing this kind of work over several decades, this is a new phenomenon in my experience. Now, red dye number 3 is also just known as number 3 or red number 3. I think it also goes by the name of E127 because of its chemical derivation. Now, it turns out there are some other red dyes that can be used to color foods that are much more natural and have really never been associated with any of these chronic illnesses. For example, the red color that comes from red beets is a good substitute for some of these synthetic dyes like red dye number 3. I think what we're going to be able to see is not only elimination of other chemicals like this, but we're going to be seeing a whole retooling of the American diet in a way that leads to better health and reduction of chronic illness. For one thing, we've lagged behind a lot of other countries in the world that pay a lot more attention to their food supplies. One example would be the European Union. There's many food additives that are completely lawful in the European Union, which are able to be added into our foods here in the United States. Part of it has to do with the fact that the food industry here in the United States has a special place thanks to lobbying and other ways that they can influence the legislation and the way the laws are enforced and the different administrative rules that are put in place to allow them to, unfortunately, have our diet be exposing us to many of these dangerous substances. So that's red dye number 3. I think we should all be excited that the FDA banned it on January 15th. There are good alternatives, and it's going to be one little step in the direction toward hopefully making Americans healthy again, which is certainly something that I'm all for, and it will protect our children. It will lower the risks of cancers and other diseases. Thanks for your attention.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.